The need for action has been underlined by a high and possibly climbing death rate, complaints from employers as they struggle to hire a drug-free workforce, and concerns from parents as the epidemic tightens its grip on American youth. This is a quote from Janine Similak, who is someone who has studied the opioid crisis. The opioid crisis is something we cannot ignore anymore as a nation. The epidemic is killing 91 Americans each day based on CDC estimates. This issue affects everyone, no matter on race, gender, socioeconomic background, or age. Today I will recap why the epidemic is a problem, who is affected by this problem, why we should care, and what we can do to solve this problem, and how towns have implemented these solutions. First, I will recap this problem. One of the big questions is, how big is this problem? This problem is huge. As I mentioned before in my introduction, the opioid crisis kills 91 Americans each day. Also, 2 million Americans 12 years or older were addicted to painkillers in 2016. Also, 12.5 million people misused prescription opioids in 2016 as well. Another big question is, who is affected by this problem? Everyone is affected by this problem. No race, gender, or socioeconomic background is not exposed to this problem. However, certain races do have a higher chance of getting addicted to opioids, such as Caucasians and Native Americans. Also, all ages can be addicted to opioids. However, the biggest age range that is addicted to opioids is the 18 to 25-year-old age range. Also, all socioeconomic backgrounds are affected. We have seen studies show that no matter how much money you make, you can be affected by this problem. Also, after marijuana use, prescription and over-the-counter medicines are most abused by high school seniors. Also, more than 18 women die every day from the opioid crisis, and more people died last year from the opioid crisis than car accidents. Why should this concern us? The opioid crisis is a growing matter. The opioid crisis is killing more people at a faster rate than the AIDS epidemic did. Also, President Trump recently declared this a public health emergency. The last time there was a public health emergency was during the Zika virus. Also, the opioid epidemic is costing the government lots of money. It cost them $78.5 billion in 2013. Also, as I mentioned before, the death rate for the opioid crisis is extremely high. So, what are some solutions we can do to cure this problem? The first solution that I found works is community addiction treatment. Community addiction treatment is getting help for people in the community who are addicted to drugs such as opioids. This will help people who need help get the help they need, so this way they're not going back on the streets and finding more drugs and hopefully not overdosing. One town or one industry that I found was helping with this was in Norton, Kansas. For 50 years, Valley Hope, which is an addiction community outreach program, has treated more than 300,000 patients. They believe that the fight is not only just getting them in treatments. They believe to fight this epidemic, you need to eliminate stigmatism, judgment, and silence of those suffering. Also, they believe that one of the biggest things is that you have to help monitor these patients. They can't just come in for one night, a week, 2 weeks, stay at an inpatient facility, and just stay there. They need to check back every week to 2 weeks to make sure that they are still not taking drugs, and so they're getting the help they need, such as follow-ups, outpatient checkups, and all that stuff. Also, something that the United States need to do is allow Medicaid to work at treatment facilities. Right now, it costs a lot of money to go to treatment facilities, and there are not many open in the United States. Thus, when we have so many people addicted to drugs, there's nowhere for them to go to get help. Lastly, Elizabeth Ziner of Indiana, Aurora, Indiana to be exact, saw that there was such a need. She was a paramedic in her hometown of Aurora, and she went from having no overdoses every day to getting 2 for a 24-hour shift. She realized there was a need for these treatment facilities, so she opened up her own treatment facilities. Between these 2 treatment facilities, the one in Aurora and the one in Norton, Kansas, They believe they've seen a decrease in deaths and overdoses in their town, which I think is a phenomenal thing. Another solution that we need is new guidelines for prescription drugs. Along with this, we need education. Since 1909, sales of prescription opioids have quadrupled. Thus, we need to have new guidelines to make sure we're not prescribing as many, so not as many people are getting addicted. Many legislators agree we need to overhaul the sales of prescription drugs. So the CDC has made new guidelines to make sure this is possible. They believe that they should first prescribe non-opioid therapies such as exercise, physical therapy, yoga, meditation for pain management. Also, they believe that we should be giving out the lowest dosage. They also think that we need to monitor patients at a better. So this way we need to have outpatient treatments for them. We need to make sure we're seeing our patients, and it's not just a one-stop shop so they're not coming into the hospitals hoping to get the drugs they want or need. Also, they also believe the pain scale has been a problem with the opioid crisis, as it is a very subjective pain scale. As you know, somebody could come in saying they're dying, but really sleeping at a pain scale of 12, but somebody who could have a limb cut off as pain says their pain is only 2. The pain scale is making it easier for people to get these drugs. Also, another thing that another company that has implemented new regulation is the FDA. They released new guidelines and new drug facts on the back of medications about the risks of these opioids. Somebody who also who is implementing this change is Melissa Jones of Pennsylvania. Melissa Jones is a healthcare worker, and she works for Alosa Health, which is an organization that aims to educate people on the opioid crisis. She travels to different hospitals and just educates patients about what can happen when you get addicted to drugs. So in conclusion, we have seen that the opioid crisis affects everyone. As I mentioned before, 91 Americans die each day from the opioid crisis. This is a number that could go up. So, as I said, the opioid crisis affects everyone, no matter your age, socioeconomic background, or any other factor related to that. It is a huge problem and is something we need to solve soon by having new regulations for these drugs, and then also a community addiction treatment. If 91 people are dying every day, that's almost your whole classroom. Could you imagine going to class and having every single one of your classmates dead from an opioid crisis? Thus, we really need to solve this problem.